I'm the personalised care lead for General Practice Alliance. So I may be joined by Emily later. Emily was our project manager, and she's been instrumental in coordinating some of the work we'll be sharing with you today. So we're here to talk about a topic that's fundamental to improving patient outcomes and reducing health inequalities, which is healthcare literacy. Healthcare literacy is, in terms of the definition, it's about more than just reading ability. It's about people being able to find, understand and use health information and services to make informed decisions about their care. And unfortunately, many of our patients face significant barriers in doing just that. So we'll be looking at this challenge from a primary care perspective. We know that general practice is often the first point of contact for patients, and it's where many of these barriers become visible. So whether it's difficulty understanding appointment letters, navigating digital systems, or making sense of treatment plans. And our aim is not only to highlight the scale and impact of low healthcare literacy, but also to share some practical tips and tools and some resources that can help primary care colleagues support patients more effectively. So we hope that this session gives you some insights and ideas and inspiration to make health information more accessible and empowering for everybody. So we've been running a project focused on increasing awareness of cancer screening in communities across Northamptonshire where uptake is particularly low. And we concentrated our efforts in Central and East Northampton and the Wellingborough West local area partnership areas. So those, according to the NARP data, the analytics data that our lovely ICB were talking about earlier, are those places that experience high levels of deprivation and are also home to large Asian and Afro-Caribbean populations. So through community outreach, our team built some trusted relationships and engaged in quite a significant number of meaningful conversations, both in groups and one-to-one. And we created some safe spaces for people to share their experiences. We know that talking about cancer is not something people would naturally bring up in a conversation. So actually just having permission to have those conversations in a safe group environment really opened up some conversations that people really needed to have, and really helped us to understand the picture as to where some of those barriers lay in terms of people accessing the screening programmes. Importantly, we also engaged with the homeless community and individuals facing substance misuse issues. So these were groups that are often overlooked in mainstream health messaging. And these individuals face unique and significant barriers. So if you're homeless, how do you receive a fit kit for bowel screening? Or how do you get a letter or book an appointment when you don't have a fixed address or access to digital services? These are real practical challenges that prevent people from accessing even the most basic preventative care. And the messages that came through loud and clear is that the issue wasn't just about cancer screening, it was about access to healthcare more broadly. And many of the people we spoke to are really struggling to navigate the system. So pointing to that deeper issue of low healthcare literacy. So these findings were also echoed in another local project led by Annabelle Pickering from C2C Social Action. She explored why health inequalities persist among hard to reach and seldom heard women in central Northampton. So Annabelle and her team held 59 conversations, and what they heard was quite powerful. 34 women spoke about a lack of trust between patients and medical services, and 25 described difficulties accessing healthcare systems. Many felt they were being sidelined because of their ethnicity, or that decisions like not being given prescriptions were made to save the NHS money, and booking appointments are often seen as intentionally difficult, and both language barriers and lifestyle constraints such as caring responsibilities or work commitments made accessing services like e-consultations even harder. So we acknowledge that some of these concerns might not be intentional or even part of a real systemic problem, but it's about perception, and perception matters. When people feel unheard, excluded or mistrustful of the system, it affects their willingness to engage with healthcare services, and that has real consequences. So people experiencing health inequalities in the UK face a wide range of systemic, social and practical barriers that make it difficult to access GP services. And these insights are drawn from recent research by the Health Foundation and NHS England and other health and equity studies. And they reflect what many of us have seen in practice every day. So one of the key issues is something known as candidacy, which is the idea of perceived eligibility. So some people simply don't see themselves as entitled to seek care. And this is especially true for people who've had negative past experiences or feel judged or dismissed when they do try to access services. So it's a common theme among those experiencing homelessness or migrants and people living with mental health conditions. Language and communication barriers. I know both our population health team and Awana have touched on this, but non-English speakers and those with low literacy levels often struggle to understand how to book appointments or describe their symptoms. And when there's a lack of interpreters or translated materials, these difficulties are then compounded. We also need to talk about digital exclusion. So many people in deprived communities don't have access to smartphones or reliable internet or the digital skills needed to use online booking systems or video consultations. And as services become increasingly digital first, this gap becomes even more problematic. And then there's the issue of cultural and systemic mistrust. So some ethnic minority groups reported feeling dismissed or not taken seriously by healthcare professionals, and historical discrimination and a lack of cultural competence in services can lead to those deep-rooted mistrusts that which understandably deter people from seeking care. Inflexible appointment systems also play a role. So like the rigid 8 a.m. phone lines or online only booking options disadvantage people who work irregular hours and have caring responsibilities or live with mental health conditions or neurodivergence. So these systems don't reflect the realities of many people's lives. I think also mentioned, but transport and location are further barriers, and people living in those rural areas or underserved urban communities may face long travel times or lack affordable transport options to reach their GP practices. And finally, there's the fear of costs or immigration checks. So some migrants and asylum seekers avoid GP services altogether because they're worried about being charged or reported to immigration authorities, even though GP care is free. So we also want to acknowledge that there are ongoing efforts across the system to address these barriers and improve healthcare literacy and rebuild trust. And there are many teams working both locally and nationally to make services more inclusive, accessible and responsive to the needs of diverse communities. However, these findings remind us that is still more to do, and that listening to those lived experience kind of stories must remain at the heart of that work. So the local projects and the wider data, they've shown us that improving healthcare literacy is not just a nice to have, it's really essential if we want to reduce inequalities and improve outcomes across our communities. So when we talk about healthcare literacy, it's important to recognise the scale of the challenge. So in the UK, more than 4 in 10 adults struggle to understand health information that's written for the general public. So that's nearly half of the population who may not be able to fully grasp the details of their diagnosis or treatment plans or even their basic health advice. So to put that in perspective, 7.1 million adults in the UK read at or below the level of a typical 9-year-old. And this has serious implications for how we communicate health messages and support people in making informed decisions about their care. And the consequences of low healthcare literacy, they're quite far-reaching. So it's been linked to poorer general health, increased hospital admissions, lower vaccination uptake, and even reduced life expectancy. And these aren't just statistics, they reflect real lives impacted by a system that isn't always accessible or inclusive. Certain groups are especially at risk, people facing language barriers, those with learning disabilities, and people living with dementia. And these communities often face additional challenges in understanding and navigating healthcare services, which can further widen existing health inequalities. So improving health and literacy isn't just about simplifying leaflets or translating materials, it's also about creating a system that meets people where they are and empowers them to take control of their health. So good health literacy is absolutely critical. It directly influences a person's ability to manage their health and navigate the healthcare system effectively. And when someone's got strong health literacy, they're more likely to understand their diagnosis and treatment options. They are more likely to follow medication instructions correctly, attend follow-up appointments, and manage long-term conditions like diabetes or asthma with confidence. And all of this contributes to better health outcomes. It also helps reduce healthcare costs. People with good health literacy tend to make better use of preventative services like screenings and vaccinations, and they're less likely to end up in A&E or require hospital admissions due to avoidable complications. It also means that there are fewer unnecessary tests or treatments caused by misunderstandings. And patient safety improves too. So when individuals understand their care, they're more likely to spot errors or ask questions and clarify instructions. And they can give informed consent with confidence, which is a vital part of safe and ethical healthcare. So beyond the clinical benefits, health literacy empowers people and it gives them the confidence to make informed decisions, advocate for themselves, and feel more in control of their health. It also helps reduce the anxiety and confusion that many people feel during medical appointments. And finally, improving health literacy is a powerful tool for tackling health inequalities. It helps level the playing field for groups who often face barriers, such as people with disabilities, older adults, non-native speakers, and those with lower educational income levels. So when we talk about improving healthcare access and outcomes, health literacy isn't just part of the solution, it's foundational. Mel, is Emily here?
She is.
Emily,
I
do you
am
want to take
indeed.
over?
Absolutely. Yeah, it would be great. So before we move on, Helen, do you want me to go into the legal obligations or are we skipping straight onto the Mentimeter?
No, skip onto the Mentimeter.
Fantastic. So before we move on, we'd really like to open up the conversations and hear from all of you. We know that accessibility and inclusive care are priorities across all of our practices, and many of the principles that have been discussed today, whether around healthcare literacy, reasonable adjustments, or communication, are already part of the ways that work. But we also know that real world challenges can make this difficult. You might be facing time and capacity pressures that limit the ability to tailor communication or follow up with patients, or even physical constraints in your buildings, like limited space for quiet areas or accessible facilities. So we'd really love to hear from you. Please log into the Mentimeter on your phones or computers by hovering over the QR code or entering the code shown on the screen at menti.com. And we would love to hear what challenges you are facing in your practice.
We've already got quite a few people that have kind of highlighted some of those challenges, and I don't think any of them are any surprise really. So appointment slots, we're under pressure, aren't we,
Yes.
as a healthcare system, and absolutely it's a big ask, isn't it, among all the other main things that we have to deal with. Yeah, time, capacity, funding.
Yeah, absolutely. There's so many complexities around with how we provide care. And just to add in, if anyone can't access the Menti and they want to make us aware of challenges they're facing, please use the chat, just so we can capture everything.
Should I move on? And if you guys want to carry on kind of adding anything, you're more than welcome to do that as we carry on.
Yep, works for me. Keep on adding those items to the Menti, please. The more information we can get, the better equipped we are to understand what you're all facing. So Helen, are you happy for me to crack on?
Yeah, I'll move on to slide 8.
So to help us better understand and address the challenges that are faced in practice, we've established a healthcare literacy working group. This group brings together a range of voices from across the system, including GPs, practice managers, personalised care staff, and members of the ICB population health team. Our aim is to develop a toolkit of practical resources to support improved healthcare literacy and reduce access barriers for those experiencing health inequalities. As part of this work, the group has identified several key challenges that many of you will recognise. Time and capacity pressures that make it difficult to personalise communication, limited awareness of the specific barriers some people face. Telephone translation services can be time-consuming to arrange, may not offer the required language, and aren't always appropriate for the patient's needs. Preferred language and communication needs are often not captured at registration, which limits our ability to respond effectively to our patients' needs. And even when we try to gather this data, it can set unrealistic expectations, because translating medical information confidently and accurately takes time, skill, and resources that simply might not be available. And many of these challenges are systemic. They're not driven or monitored at a contractual level, which means they often fall down the priority list in an already stretched system. We know these issues are not new, but we also know that they are persistent. And that's why we're inviting anyone on today's session who's interested in joining the steering group or sharing their experiences of what they do in practice. Please email either Helen or myself, and we'll be sharing our details along with the slides after the session.
Thank you, Emily. So we'd also love to hear your thoughts. We've been talking about some of the barriers people face when trying to access their GP, and especially those experiencing health inequalities. So we'd like to ask, how can we help people who face health inequalities get to their GP and access the care they need more easily? I think there are some amazing solutions out there, and I know that in the next slide, I'll kind of share some of the solutions that our healthcare literacy group have come across. And I think we are an innovative group of people, and I'm sure that we've all put some strategies in place that have made a difference. So please take a moment to log into your Mentimeter and make sure that if you do have any suggestions, whether you've implemented them or not implemented them, that you share those with us and for the rest of the group on the session. Oh, there we go. Sorry, you should be able to do that now. We'd also be really keen to hear offline about the amazing work already happening in your practices to address these challenges. If you're doing something that's working well, or you've got ideas you'd like to share more directly, please do reach out after the session. We really would love to hear from you. And your input in helping shape the work we're doing will ensure that it reflects the realities of practice.
Absolutely. We are a small group of people in the healthcare literacy working group, and we bring the experience we have and lots of energy to create solutions. However, the more brains we have on this, the better. The more ideas for solutions we have, the better, because there is no silly idea. We just need to understand all the different approaches that could be taken.
Oh, we've got a few already. This is brilliant.
Fantastic.
We'd love more staff and more appointment slots.
Absolutely.
And yeah, you know what, you're absolutely right. Patients do need to take some responsibility as well. And it's a two-way thing. I think we can make some changes and address some barriers within practices, but it's also about going out and educating and sharing kind of how to access and your healthcare services within our communities. So I think it's definitely a two-way process and absolutely not all on our shoulders at all. But I think working together, we should be able to make a little bit of a dent and make some changes. So Emily,
Fantastic. Thank you, Helen. So before we finish, we want to leave you with a few of the practical ideas that have come out of our work and conversations with colleagues across the system. So we want to raise awareness of the challenges patients are talking about in surgery. Sometimes we just need to name the issue, and that can make a big difference. Don't be afraid to double book appointments if needed. It may take more time up front, but it can save time and improve outcomes in the long run. Make use of your personalised care staff in practice. They can give people the time to talk, help create personalised care and support plans, including accessibility and communication needs, and support with the wider social determinants of health. We had some ideas for world maps or a printout of flags at reception to help identify language needs early on. If someone comes into reception and they don't have any English at all, even identifying what language they need can be a challenge. So finding a workaround for that can be really, really useful. A key one, ensure that your GP websites have accessibility and language plugins, so the information is accessible to people from a wide range of backgrounds. Use medically approved translation tools like Canopy Speak or Medibabble for basic communication, and also display the interpreter telephone line number in every consultation room to make it easy for staff to access. Our staff are so busy with so many competing demands and so many streams of information. Making things as simple and clear to access as possible not only reminds them, but also demonstrates to patients what's available for their support.
Thank you, Emily. And that brings us to the end of our presentation. Thanks so much for listening and for all your contributions. We'll be working in the background and we'll be developing a toolkit of resources to help address healthcare literacy challenges. Once ready, it will be hosted on the Primary Care Training Hub website, and we hope it will be a valuable support for you and your teams. And we'll also share our contact details along with the slides after the session. So if you'd like to get involved or share examples of the great work happening in your practices, please do get in touch. And thanks again. We look forward to continuing this work together.
Thank you.
That's lovely. Thank you, ladies. Thank you again for starting a little bit earlier as well. Really appreciate that. And for you, Emily, jumping in last minute. That's amazing. What I'm going to suggest, so we have Toyosi EDI training at 3. Oh, thank you. And she's just messaged to say she's happy to start a little bit earlier. But because we didn't get that break, we'll just do a quick 5 minutes. Toilet break, coffee break, fill up those cups, have a walk around for a second. And then in 5 minutes time, so at 22, we'll start the session. Is that all right? Lovely. Thank you. Oh, we've got a hand up there from John. Oh, it's gone. Oh, it's back. John, do you want to put in the chat? Is it a question to Helen and Emily?
Melanie, he's put it in the Q&A section, and he's made a point about using translation tools on website. Are we aware that NHSE guidance is not to use these tools? No, we weren't aware of that. This was a piece of a suggestion that came out of the working group. So that's certainly something we can look into and follow up. Thank you very much for the feedback, John.
Emily, can I add something to this? Yeah, I just